Cystic fibrosis is a disease that some children are born with. It causes thick mucus and other fluids to build up and clog different parts of the body, including the lungs, pancreas, liver, and intestine. The thick mucus in the lungs causes people with cystic fibrosis to get frequent lung infections. Over time, these infections damage the lungs. The thick fluids in the pancreas and liver keep the intestine from absorbing certain nutrients from food. This affects the child's growth and causes abnormal bowel movements. Cystic fibrosis is caused by an abnormal gene. To get the disease, people need to get the abnormal gene from both their mother and father. If people get the abnormal gene from only one parent, they will not have cystic fibrosis, but they will have a chance of passing on the abnormal gene to their children. Cystic fibrosis is a lifelong condition. As of now, doctors can't cure the disease, but they can use different treatments to help with symptoms. People with cystic fibrosis don't live as long as people without the disease. But better treatments are helping people with cystic fibrosis live longer. To help manage your child's disease for as long as possible, it's important to work closely with his or her doctor. People can have different symptoms at different times. Most people start having symptoms as a baby or a young child. A few people start having symptoms as teens or adults. A person's symptoms usually get worse over time. These symptoms can include not growing or gaining weight normally, a long-lasting cough that usually brings up mucus or blood, trouble breathing or breathing that sounds like whistling, skin that tastes salty, belly pain, diarrhea or constipation, and infertility. If a person has symptoms of cystic fibrosis, or there is a family member with the disease, his or her doctor can do testing to check for the disease. These tests include a sweat test. During this test, the doctor makes a person sweat and then measures the amount of salt in the sweat. Blood tests are also used to check for the abnormal gene. Cystic fibrosis testing can also happen at other times. Some pregnant women choose to test their unborn baby for the disease. Plus, every baby in the United States is tested for the disease at birth. People with cystic fibrosis can have different treatments to help with symptoms and prevention of further problems. Treatments to help the lungs can include antibiotic medications to help prevent or treat infections, medicines to help open up the airways in the lungs, medicines to help thin out the mucus in the lungs, airway clearance therapy, or a lung transplant. Airway clearance therapy is sometimes called chest physiotherapy. There is more than one way to do this, and your child's doctor or nurse can show you the different ways. One way involves thumping your child's chest and back to loosen mucus. Other ways involve using special devices. These include a vibrating vest or devices children breathe into. A lung transplant is done only if people have severe disease and meet certain conditions. Treatments to help the digestive system can include taking medications called enzymes that help break down the food in the intestines. For most children, this involves taking enzymes at every meal and snack and following a special diet. To help your child stay as healthy as possible, you can help him or her gain enough weight by asking the doctor or nurse which foods are best to feed your child. Do not let anyone smoke in the home, help him or her get regular exercise, and follow all your doctor's instructions about treatments and visits. To help protect your child from getting infection, be sure your child gets all the vaccines his or her doctor recommends, as vaccines are treatments to prevent infection. To learn more about cystic fibrosis, talk with your child's doctor or nurse. The Cystic Fibrosis Foundation also has a lot of information. Their website is www.cff.org. Their toll-free phone number in the U.S. is 1-800-344-4823.